So when we talk about health hazard of the haze, we are actually referring to particulate matter 2.5, right, which originates from the burning of biomass fuel. And these particulate matters get into our body via the respiratory system, and as such, they can affect the cardiovascular system as well. All right, and the way they affect us is through causing inflammation in the upper airways. They can cause upper respiratory tract symptoms, so they can cause nasal symptoms such as sneezing, running nose. In the throat, they can cause throat itchiness, sore throat, hoarseness of voice. And if these particulate matters get into the lower airway passages, for example, the trachea or the bronchi, you can get conditions like acute bronchitis, acute tracheobronchitis. So patients will have coughing, they will have a lot of phlegm production, shortness of breath, wheezing, chest tightness, right? And all of this can affect the cardiovascular system. So you're more likely to see heart attacks during this period where there's sustained and prolonged exposure to haze. And the most high-risk individuals are those with chronic lung conditions, those with heart diseases, the elderly, the children, as well as pregnant women. So for this group of individuals, the best way to avoid the ill effect of the haze is actually to stay at home and not to go out outdoors unnecessarily. Right? Now, that's easier said than done. For most of us, that's not possible, and if that is the case, then you should protect yourself by wearing an N95 mask. Drink more water, obviously, if you have to go out, and if possible, like I mentioned earlier, stay at home, close all your windows, switch on your air purifier if you can. Okay, so the N95 mask, as its name suggests, it's effective 95% of the time to actually filter noxious substances that are found in the environment. For example, dust, for example, molds, and as well as pathogens like bacteria and viruses. So when we're talking about using it during the haze period, it's 95% effective in actually filtering particulate matter 2.5, right, which is actually sized at 2.5 micron, which cannot cross the N95 mask. So if you have chronic respiratory conditions and you are otherwise stable, but during the haze period you develop a worsening and more persistent cough, if you become more breathless with increasing chest tightness, wheezing, and there's a change in the amount of phlegm that you produce compared to normal days, or is there a change in the color of the phlegm that you tend to produce on a normal day, these are the usual symptoms that I would want my patients to seek opinion from your GP or your chest physician. All right, for patients with heart diseases, they should also seek physician opinion if they have symptoms that are out of the norm for them. For example, if they have persistent left-sided chest pain that lasts for more than the usual length of time, and which is not relieved by their usual medication, then it's always an indication to seek medical opinion at the nearest available healthcare facilities. Just also like to add that for those individuals who I've mentioned is high risk when they are exposed to particulate matters from the haze, do not try to self-medicate. Alright, if you are unwell during this period, if you are experiencing respiratory symptoms, if you are experiencing heart symptoms, right, go to your physician immediately. Try not to self-medicate, because sometimes that can actually make things worse as well. Not to mention delay in diagnosis and leading to increased morbidity, mortality.